Hey everyone, welcome back to EazyMed. In today's video, we'll be diving into some important MCQs on the respiratory system, a perfect way to test your knowledge and strengthen your concepts for exam. The nurse observes constant bubbling in the water seal chamber of a closed chest drainage system. What should the nurse conclude? 1. The system is functioning normally. 2. The client has a pneumothorax. 3. The system has an air leak. 4. The chest tube is obstructed. And the correct answer is 3. The system has an air leak. Rationales. Constant bubbling in the chamber indicates an air leak and requires immediate intervention. The client with a pneumothorax will have intermittent bubbling in the water seal chamber. Clients without a pneumothorax should have no evidence of bubbling in the chamber. If the tube is obstructed, the nurse should notice that the fluid has stopped fluctuating in the water seal chamber. A client has the following arterial blood gas, ABG values: pH 7.112, partial pressure of arterial carbon dioxide, 40 millimeters Högers, and bicarbonate, 15 milliliters per liter. These ABG values suggest which disorder? 1. Respiratory alkalosis. 2. Respiratory acidosis. 3. Metabolic alkalosis. 4. Metabolic acidosis. And the correct answer is 4. Metabolic acidosis rationales. This client's pH value is below normal, indicating acidosis. The HCO3 value also is below normal, reflecting an overwhelming accumulation of acids or excessive loss of base, which suggests metabolic acidosis. The PaCO2 value is normal, indicating absence of respiratory compensation. These ABG values eliminate the other options. A client, confused and short of breath, is brought to the emergency department by a family member. The medical history reveals chronic bronchitis and hypertension. To learn more about the client's current respiratory problem, the physician orders a chest X-ray and arterial blood gas (ABG) analysis. When reviewing the ABG report, the nurse sees many abbreviations. What does a lowercase a in an ABG value represent? 1. Acid-base balance. 2. Arterial blood. 3. Arterial oxygen saturation. 4. Alveoli, and the correct answer is 2. Arterial blood. Rationales. A lowercase a in an ABG value represents arterial blood. For instance, the abbreviation PaO2 refers to the partial pressure of oxygen in arterial blood. The pH value reflects the acid-base balance in arterial blood. SaO2 indicates arterial oxygen saturation. An uppercase A represents alveolar conditions. For example, PaO2 indicates the partial pressure of oxygen in the alveoli. A nurse is performing a respiratory assessment on a client with pneumonia. She asks the client to say 99 several times. Through her stethoscope, she hears the words clearly over his left lower lobe. What term should the nurse use to document this finding? 1. Bronchophony. 2. Tactile fremitus. 3. Crepitation. 4. Egophony. And the correct answer is 1. Bronchophony. Rationales. Bronchophony is an increased intensity and clarity of voice sounds heard over a bronchus surrounded by consolidated lung tissue. Over normal lung tissue, the words are unintelligible. However, over areas of tissue consolidation, such as with pneumonia, the words are clear because the tissue enhances the sounds. Tactile fremitus is the vibration felt when the client speaks while the nurse holds her hand against his chest. Crepitation is a crackling sound heard in certain diseases, such as pneumonia. Egophony is an abnormal change in tone heard when the client speaks normally as the nurse auscultates his chest. An adult client with cystic fibrosis is admitted to an acute care facility with an acute respiratory infection. Prescribed respiratory treatment includes chest physiotherapy. When should the nurse perform this procedure? 1. Immediately before a meal. 2. At least 2 hours after a meal. 3. When bronchospasms occur. 4. When secretions have mobilized. And the correct answer is 2. At least 2 hours after a meal. Rationales. The nurse should perform chest physiotherapy at least 2 hours after a meal to reduce the risk of vomiting and aspiration. Performing it immediately before a meal may tire the client and impair the ability to eat. Percussion and vibration, components of chest physiotherapy, may worsen bronchospasms. Therefore, the procedure is contraindicated in clients with bronchospasms. Secretions that have mobilized, especially when suction equipment isn't available, are a contraindication for postural drainage, another component of chest physiotherapy. The client with tuberculosis is to be discharged home with nursing follow-up. Which aspect of nursing care will have the highest priority? 1. Offering the client emotional support. 2. Teaching the client about the disease and its treatment. 3. Coordinating various agency services. 4. Assessing the client's environment for sanitation. And the correct answer is 2. Teaching the client about disease and its treatment. Rationale. Ensuring that the client is well educated about tuberculosis is the highest priority. Education of the client and family is essential to help the client understand the need for completing the prescribed drug therapy to cure the disease. Offering the client emotional support, coordinating various agency services, and assessing the environment may be part of the care for the client with tuberculosis. However, these interventions are of less importance than education about the disease process and its treatment. A recent immigrant from Vietnam is diagnosed with pulmonary tuberculosis, TB. Which intervention is most important for the nurse to implement with this client? 1. Client teaching about the cause of TB. 2. Reviewing the risk factors for TB. 3. Developing a list of people with whom the client has had contact. 4. Client teaching about the importance of TB. Correct answer is 3. Developing a list of people with whom the client has had contact. Rationales. To lessen the spread of TB, everyone who had contact with the client must undergo a chest X-ray and TB skin test. Testing will help determine if the client infected anyone else. The remaining options are important areas to address when educating high-risk populations about TB prior to its development. A nurse is caring for a client who has a tracheostomy and temperature of 103 degrees Fahrenheit. Which intervention will most likely lower the client's arterial blood oxygen saturation? 1. Endotracheal suctioning. 2. Encouragement of coughing. 3. Use of cooling blanket. 4. Incentive spirometry. And the correct answer is 1. Endotracheal suctioning. Rationales. Endotracheal suctioning removes secretions as well as gases from the airway and lowers the arterial oxygen saturation, SaO2 level. Coughing and incentive spirometry improve oxygenation and should raise or maintain oxygen saturation. Because of superficial vasoconstriction, using a cooling blanket can lower peripheral oxygen saturation readings, but SaO2 levels wouldn't be affected. A client with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per min, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. What should the nurse do first? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. And the correct answer is 4. Administer bronchodilators as prescribed. Rationale. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as would drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. A client has a sucking stab wound to the chest. Which action should the nurse take first? 1. Draw blood for a hematocrit and hemoglobin level. 2. Apply a dressing over the wound and tape it on 3 sides. 3. Prepare a chest tube insertion tray. 4. Prepare to start an IV line. And the correct answer is 2. Apply a dressing over the wound and tape it on 3 sides. Rationales. The nurse should immediately apply a dressing over the stab wound and tape it on 3 sides to allow air to escape and to prevent tension pneumothorax, which is more life-threatening than an open chest wound. Only after covering and taping the wound should the nurse draw blood for laboratory tests, assist with chest tube insertion, and start an IV line. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more such content.